Hello, my name is Niall McKay and welcome to Living with PSC, a podcast about the rare disease of primary sclerosing cholangitis. Now, PSC causes the bile ducts inside and outside the liver to become scarred, narrowed and eventually blocked, and leads to liver cirrhosis. In this podcast, we aim to dispel some of the myths about the disease. Well, welcome. I'm here with Joanne Hatchett, who is the Medical Science Liaison with PSC Partners. Welcome, Joanne.
Hi, Niall. It's great to be here with you.
I wonder if you can tell me what the Medical Science Liaison Officer does.
I've been a registered nurse since 1978 and retired after 24 years as a nurse practitioner in internal medicine and palliative care. At the time, I can't tell you how excited I was to work with PSC Partners. So what do I do as Medical Science Liaison? I bring the medical perspective from my role as a nurse practitioner to help support the needs of the PSC Partners community, bringing medical aspects to the different programs that PSC Partners has. So this can include finding current scientific or medical information, working with our team, which now includes Ruth Empire, our new Director of Research Strategy, and focusing a lot on PSC research. I can give you an example of something I've done if you'd like.
Of course, yes, thanks.
I was the lead for the externally led patient-focused drug development forum called a PFDD last October, with the purpose of having the FDA, researchers, pharma, hear the voice of PSC patients and caregivers to inform the Food and Drug Administration, FDA, and researchers, pharma, about what it was like to live with PSC. So coordinating this, I had about 48 PSCers and caregivers who actually talked about their symptoms and their stories of living with PSC, how it affected their daily lives, and what was important to them about the needs for drug development and a cure. In addition to all these people who participated on live Zoom panels or did videos, which are all available on the PSC website, my small advertisement. We had so many PSCers and caregivers who called in with questions and comments. So this whole activity, which took 9 months to actually pull it all together, informed both the FDA, pharma, and researchers, giving them a whole new light on how PSC affects patients. So it's very exciting. That helped PSC Partners have new relationships with more pharmaceutical companies and biotechs. We've since done 2 mini PFDDs, one that was specifically for pharma staff and another for primary investigators and site coordinators of an active clinical trial, which was a researcher who said he'd never met anybody who had PSC. And he explained how this really made him understand what it's like to live with this. Another pharma representative said there wasn't a dry eye in the room after listening to these stories.
I was on one of those panels myself. It was a very emotional time. So really, as medical liaison, you are a medium or a translator, if you like, where you're bringing the medical community into the PSC partners and helping translate those things for people.
It's both translating for patients and caregivers. It also is helping translate to researchers and clinicians, pharma, and all of the outside world. PSC Partners also also has a Chan Zuckerberg grant that was awarded to them last year. That is another way that's opened a whole new world of communication with 30 other rare disease groups who are part of this grant. And the whole goal is to bring the patient voice first and foremost, driving more research for each of these rare diseases.
One of the things that I love about PSC Partners, the organization speaks for the patients, and it's one of the things that's often missing, particularly with the rare disease. As a fellow patient myself, when I got diagnosed with the disease, and the doctors who I was talking to with the best will in the world weren't experts in autoimmune diseases and didn't quite understand it. And as I got into it and found the right doctors, I found doctors who were aware of PSC Partners and who were aware of the conferences and knew what was going on for the patients. And that was a wonderful help.
And your experience is not at all unusual. That's very, very common. And so many people say once they find PSC Partners, it's that community to, especially here, I'm not alone. My son was diagnosed with PSC and ulcerative colitis 15 years ago. He also has ulcerative colitis, spondyloarthritis, and severe degenerative joint disease of his jaw. So I began volunteering with PSC Partners after the second annual conference in 2006. The other, you made me think too of something that researchers have said, which is PSC is the black box of liver disease, where so little is still known, and we need to delve deep so that we discover the unknown aspects of it.
I understand. Yeah, certainly when I came to the first conference, my doctor at that time, I hadn't got the right doctor at that time, but my doctor at that time had said, there's two things you can do. You can use antibiotics to bring down your infections, and then you will need a liver transplant. And PSC, the conference just sort of opened up a whole world to me where there were doctors and experts from all over the world, not just America, talking about the disease and the research outcomes. And it seems, I'll get to the research now, because a lot has changed even in that short time in terms of understanding the illness, and also we're not at a treatment like, say, hepatitis at the moment. But that may not be that far off.
Yes, I think there is progress, and there's so many different facets of PSC research. There's finding treatments and the eventual cure, and then there's the whole aspect of patient symptoms. And can we do a much better job of dealing with the symptoms that people are living with? So there's all of those aspects. I'll mention quickly that for the patient-focused drug development meeting, we actually did a survey that we called Our Voices. And the Our Voices survey was actually taken by, I believe the latest number is 879 patients and or parents of PSCers. The survey itself covered lots of information about symptoms, medications, research, how PSC affects your function, what you think about clinical trials. But one of the most important things was asking people what was important to them about research. And the most important, highly rated response in that survey was that people wanted to slow the progression of PSC. We all hope for the cure, but in the meantime, slow or stop the progression. And that was very, very important. Secondly, they wanted to have earlier diagnosis of cancer, especially cholangiocarcinoma. And then the third thing was better symptom management. So it gives us, that's a big area of giving us information on what PSCers hope for.
Yeah, and I often liken the sort of treatment of PSC to changing the complete engine when your car stops, rather than changing the carburetor or changing the problem. you just take out the engine, you put in a new liver. And sometimes doctors and patients see that as a cure-all for the illness, but actually it can reoccur and does in up to 30% of the cases, I believe, so there's still a lot of work to be done, I suppose, with the understanding of the illness.
Well, and I think that that's what is such an important factor in this whole focus that we have on the patient's voice. So that is a key aspect. And as an ancient nurse practitioner, I very much want to promote how PSC patients and their caregivers can better inform doctors, and we can help the doctors know how to ask patients about symptoms, because it is hard. Fatigue, itching, difficulty with sleep, those things we don't have good treatments for, or the treatments carry a whole lot of side effects.
I'll give you an example. I didn't know that my insomnia had anything to do with PSC until I attended the second conference. And somebody mentioned insomnia. Then everybody said, oh yeah, I have that. And I had no idea, And I remember Fred turning around to me saying, with this kind of a wry grin on his face as he does, he's Fred Sabernick saying, yeah, everything has to do with PSC.
And Fred was so right. It's true. It's amazing. And how the different symptoms interplay and interact. Do you not sleep because of your itch? Or are you fatigued all day long? Do you get up, waking up with what Jessica talks about as her battery? I can wake up with a full battery, a half charged, or a dead battery, and you never know what you're going to wake up with, or whether it'll hit you after you do something simple in the morning.
And it's a very difficult thing regarding employment. When you're working, you can't turn around to the person you're working for and say, I might be okay, or I might not. I don't know. I might be okay to work.
Oh, and haven't you been greeted with, oh, thank you, I'm so glad. Just let me know.
I would like to talk a little bit more, because this business of the research is very, very important, because until 5 or 6 years ago, there was very little focus on PSC as an illness among the research community and the medical community. Would I be right in saying that?
Yes, you are. Yeah. We now do blood testing that may show that somebody's liver function tests in the blood are elevated, and that may have just happened, and then they pursue that. Also, I think the non-invasive imaging that's being done now, I have a little bit of stomach pain or some concern, and so they will do an MRI potentially and be able to, it's an easier way to view issues that may show PSC as a problem.
I heard one doctor describe it as the McDonald's index that the Economist has, that some of these diseases, and we're not blaming McDonald's or a particular company for this at all, but as food changes in a country, so countries that never had PSC before are beginning to see the emergence of PSC as their diets get richer and more, with more fast food, for example.
Oh, now that's a fascinating thought that I hadn't thought about. And, that's an interesting research piece also, because one of the doctors that we're working with, he's actually part of the Chan Zuckerberg Grant, and he's also the co-host for the Boston conference in 2022, Dr. Joshua Korsnick. He's actually doing a fascinating nutritional study for PSC right now.
Would you like to tell us a little bit about the roadmap and how some of these topics have come up in the roadmap?
Unfortunately, COVID-19, the pandemic, stopped people from meeting in person. We all know that. Well, we then had to cancel the 2020 annual conference. And so to keep our community informed, a series of 7 conference webinars were given. And again, those are all available on the PSC Partners website. In addition, we got the Chan Zuckerberg Initiative grant, which I explained. And one of the goals of the grant is that PSC Partners is to establish a patient-driven, collaborative research network that includes international researchers to identify gaps in PSC research and stimulate research to closing those gaps, which is what we were just talking about for research. I mentioned Dr. Korsnick, also Dr. Chris Bolas. They are part of the PSC Partners CZI grant team. And as co-chair of the 2020 meeting, we have been talking to Dr. Korsnick about rescheduling the 2022 meeting. So Dr. Korsnick suggested having a series of educational webinars that brings together patients and researchers with the purpose of building PSC research knowledge and education for PSCers and their caregivers. And that includes building the research knowledge in our PSC community, where many PSCers are very knowledgeable about PSC and the research. We have many new PSC patients and families. And there's also people who, for whatever reason, research or science, it's like they shy away from that. Well, the goal is to bring folks together through the ROADMAP series of webinars so that we can plan and be prepared for the 2022 annual meeting and the additional component that's going to be interwoven into that meeting, which is the International Research Collaborative Network, where we are going to have more researchers attending the 2022 conference than ever. So what does ROADMAP stand for? It's Research, Opportunities and Development, Meetings to Accelerate Progress. And what I'd really like to say is the amazing thing about the ROADMAP series, because we have had several meetings already, and what we're focused on doing, and it's not too late for new people to jump on into ROADMAP. One, because the prior series is, again, all on the website, from a kickoff, which gives a big overview and compares what some of the head speakers talking about what some of their patient groups have done to expand that patient voice into the research world. And then we've started focusing on patient symptoms and the development of a patient-reported outcome measure that's PSC specific. And there's more details to that about how we are going to move forward. One of our initiatives is actually to develop a patient-specific, patient-reported outcome measure that involves the voice of PSC patients. And that first session brings in one of the researchers, Donna Yvonne, who is an expert in developing these, as well as the symptoms webinar roadmap. The 201 session brought in another expert researcher, Bryce Reeve, and together we are going to continue working with them to develop this PRO measure.
Can I just translate that a little bit for you? Just in terms of patient-reported outcome, really is that when doctors see patients, they see them when they're at their sickest, and they treat them, and then the patients go away. And what is happening with diseases like long-term illnesses like PSC is that they don't get a long view of the illness. So they don't. So once they've done their liver transplant or whatever, they'll be in a post-transplant unit probably. But doctors aren't able to, not because they don't want to, but just aren't really able to see the long-term impacts of the illness when it starts, how it progresses, and what happens.
And I think in addition to that, doctors are there to diagnose and treat. And when somebody's symptoms, we don't have a good treatment for that, and or we don't have any treatment for the disease itself, it's difficult for them because what are they going to do when you come to the office? And so a big piece of this patient-reported outcome, there are ways that the patient-reported outcome can be utilized to help clinically to track and follow your symptoms, even doing that via your cell phone or an app, as well as developing patient-reported outcome measures that can be acceptable to the FDA and used as a clinical endpoint in a clinical trial. Both of these are so important, and that's a part of the agenda here.
Great. And can we talk about some of the other things that you've discussed during the roadmap sessions, like immunotherapy, for example?
We started off with PSC research landscape. Where are we and where are we going? And then we focused on 4 different topics at the second research meeting. You mentioned microbiome, immune cells, bile acids, and genetics. And so we had speakers there who gave very brief overviews about each of these topics and the relationship potential to PSC. And then what happens in these roadmap meetings, there's first a general session where there's discussion or lecture. This upcoming roadmap is actually going to be a panel discussion in the first session, which is going to be fascinating. And this is called Charting a Path Forward, and it's October 26th. So what happens in the breakout room is you've got the expert researcher. This time we'll have, along with a young investigator. It's a small group setting for question answer and discussion. And there will be patients, families, pharma, clinicians, and researchers. The feedback we've gotten from these, and it's true feedback because we do a post-survey and people answer these questions, and they love the small breakout rooms. The comments about how amazing it is to sit in on one of these. Niall, you've been there. What do you think?
I think they're wonderful, actually, and they enabled me to ask questions of the researchers, which I found very helpful. And it enabled them to ask questions of me, which I hope they found helpful.
And that the researchers have also told us how much they've enjoyed it, how much they've learned from the PSC community, knowing that no question is, certainly nothing is stupid and nothing is too minute, because somebody may ask or say something to a researcher either during roadmap or next June when we meet with the International Collaborative Research Network. They may say something that sparks a connection or a new idea, and who knows what that may mean to research.
I just wanted to draw to a close here. So basically what the roadmap is, it's deciding a starting point of where the research is at. It's saying this is how much we know, and it's drawing a guide to say this is what we need to know and this is what needs to happen by putting both the patients and the doctors and the medical researchers together.
Actually, the one thing I do want to mention is the follow-up roadmap sessions that are upcoming. PSC drug development. And what's important about that is how to get the patient voice into drug development early so that PSC trials, those clinical trials, are set up where PSCers say, I can participate in this. And it helps the researchers know what they need to be working on. And then the last 2 sessions, natural history is so vitally important to be able to learn what the various different courses of PSC are. We know some people, it's a very fast, rapid course, and other people live with it for years and years, but it's much slower progressing. So the whole natural history piece is absolutely vital for that patient voice. So I think that's the biggest thing, is for people to know your voice is so important, and we need many, many, many voices to have the message be heard and get the broad basis of that widespread knowledge of how does PSC affect everybody, young, old, people of all diverse backgrounds, ethnicity, race. We need the voices of everybody now and at our future conference and conferences.
It's sort of like we're at the stage of discovering soap in hygiene, isn't it? I think what PSC Partners is doing will be run of the mill in about a decade, but at the moment it seems revolutionary. But why should it be revolutionary? To actually talk to the patients when you're trying to develop drugs and stuff to help them. It does seem to make a lot of sense, but it's not the way things have been done traditionally.
Right. Well, and I think the other part that I'm so looking forward to is I just can't wait to see how people who, when they go to Boston, as they see someone who it's like, I saw them on this webinar, I can go and say hello, say thank you for the research you're doing, enter into a conversation. Isn't that exciting?
Yes, no, it is. It's wonderful. So if people want to know more, they should go to...
If you go to pscpartners.org and you get the website, at the very top header on the web page, you will see roadmap. And if you click on that, that gives you access to the upcoming roadmap. It gives you access to what is roadmap so that you can see very briefly and succinctly what we've been talking about, and access to two other important things. One is all the prior roadmap sessions that you can watch, and also there is a place where you can actually write down, I have a question, I have a comment. You can add your thoughts right there. And we are keeping a long list, because one of the other important things, I'll just mention it quickly, that we're working on is the strategic research plan for PSC. And we need the patient voice there. And of course, patients and researchers will be working on this. Actually, there will be working groups at the conference for each of these topics. The patient-reported outcome measure, natural history, drug development, strategic research plan, all of that will take place during the conference. You can also still go to your favorite conference activities if you'd like. You can mix and match. There will still be peer group support groups there, just like there have been before. So all of that is there, but going back to the website, you can make comments. We are keeping a list of patients' research questions, and you're going to be hearing more and more about that. The other thing, if I could just do one other quick advertisement here, since the pandemic began, we've been doing what we call Zoom rooms, which every month for either caregivers and spouses, PSC patients, adults, and the teens. We have Zoom rooms for each of these groups, and people love them. It's a brief amount of time, but to be able to meet people, usually about half the people are brand new to PSC, and then we have folks who are living with it, and they have a great time to meet and talk to folks. So that's the other thing, that leading up to 2022 is having people be able to meet folks that they've met online.
Yeah, well, Joanne, I want to thank you very much for the work that you're doing on all of our behalves. We value it. It's very important and really wonderful to join us here today.
Well, thank you. This is the best job I've ever had, and I love working with everybody, including you. Thank you so much.
Even me.
I didn't say that. Cut that out.
Well, I'm afraid that's all the time we have for this week. For more information about PSC and for a list of people and topics we'll be covering in the near future, please go to www.pscpartners.org. That's www.pscpartners.org. PSC Partners is a non-profit organisation dedicated to providing education and support to primary sclerosing cholangitis patients. There is information and resources on the website. There is a conference once a year. There is a private Facebook group that you can also join. Also, please join our patient registry. This is an anonymous database that provides research support to the medical community who are researching this disease. Thank you very much for listening.